Hi there, I'm Rebecca Martinez Fitzgerald, and I'm just taking a break from the COVID-19 lockdown to tell you about 42 CFR Part 2. Let's get started. Now, this is a program that will teach you a little bit about the way that patient records are handled with regards to substance use treatment. Now, when I say times were simpler, I mean that in the way everything was simpler, but of course it wasn't really. Before the COVID-19 outbreak reached the US, there were two parallel federal laws protecting the confidentiality and security of patient records. So there's HIPAA, which sets certain standards for how records are handled and requires patient consent for how records are shared. And there are stiff penalties and censures for violations. For 42 CFR Part 2, friends just call it Part 2. It's a section in a completely separate healthcare law, and it governs patient records related specifically to addiction treatment. Think of it as a higher level of clearance requiring explicit approval by a patient to share any information about a client's substance use or treatment, or the fact that they were ever even in treatment. So 42 CFR Part 2 was created about 2 decades before HIPAA began regulating protected health information in 1996. In the 1970s and 80s, dependence on drugs and alcohol was widely seen as a moral failing. So federal lawmakers enacted a law to basically try to obviate stigma and fear of prosecution as factors that might discourage patients from getting into addiction treatment. Under 42 CFR Part 2, a patient's consent must identify who can receive the information by name as opposed to a general category or description of the recipient as permitted under HIPAA. Even though this requirement was relaxed to some extent in 2017 for disclosures to treating providers, it's still kind of a significant obstacle for information sharing. So supporters of 42 CFR Part 2 really like that it gives people being treated for substance use disorders greater privacy and control. They suggest it encourages more people to seek out addiction treatment, but I personally have not been able to find any evidence to support that claim. 42 CFR Part 2's general rule places privacy and confidentiality restrictions upon substance use disorder treatment records. Under the Part 2 general rule, providers may not disclose information in a substance use disorder patient's records unless the provider can either obtain specific written consent or identify an exception to the general rule that specifically authorizes a disclosure. So we've got some of those pros and cons, but something that's a factor either way are the liability and logistical concerns. For example, any mention of disordered substance use in a medical record system has to be compliant with 42 CFR Part 2, whether or not the provider is an addiction specialist. Also, Part 2's privacy restrictions mean a provider can't bill for addiction treatment unless the patient explicitly grants permission in advance. So this becomes a stumbling block because 42 CFR Part 2 is generally stricter than HIPAA, and when HIPAA and 42 CFR Part 2 conflict, basically everybody has to refer to Part 2, regardless of whether that's their area of treatment or expertise. So let's consider an example. We've got Dr. Roberts, who's a primary care physician at UNC, but also practices addiction treatment there in a separate clinic. Her patient Sam has chronic back pain and an opioid use disorder. At her primary care setting, if Dr. Roberts prescribes buprenorphine for Sam's opioid use disorder, records of this care are protected by HIPAA, so it's not just going to get out there, but they're not governed by 42 CFR Part 2. That means Sam's other UNC health providers can see evidence of this treatment and act accordingly. But if Dr. Roberts treats Sam with the same medication during her day at the substance use disorder treatment clinic, All of those notes, labs, problems, medication lists have to be sequestered behind 42 CFR Part 2, and they remain invisible to other non-addiction members of the care team. And this is risky because if Sam goes to see, say, a surgeon at the UNC Spine Center, for example, that doctor would not necessarily know about Sam's substance use disorder and might even potentially unknowingly prescribe opioids. Got another example. Say a social worker, let's call her Tiana, who learns that her client Lisa has dropped out of an addiction treatment program and has also been abusing her 6-year-old child. Let's call him Dan. Tiana can bypass 42 CFR Part 2 to make a state mandated report, but Tiana also has to protect Lisa's substance use history from subsequent disclosures. So that means she can go ahead and bypass 42 CFR Part 2 to make the initial report, but she can't share any of this info with child welfare investigators or even include it in testimony during child abuse proceedings against Lisa unless Lisa gives her written permission to do so. Now, the folks who like 42 CFR Part 2 say stigma is still a big issue and that extra level of protection is really beneficial and might be a factor in people continuing to seek out treatment. There have been several efforts to overhaul Part 2, and some have made little specific aspects easier for providers to manage information sharing while still protecting the overall statute. The Substance Abuse and Mental Health Administration, aka SAMHSA, proposed some updates last summer, but as of October, it was still a proposal, and that's the most recent federal update I've been able to find. Which brings us to present day. The COVID-19 pandemic came to the US. Hospitals and public health departments needed to act quickly to contain the spread of the virus and to coordinate treatment for patients and healthcare workers. And some of these confidentiality requirements made it tough to do so. So Congress and the White House were able to come together to put together an act called the Coronavirus Aid, Relief, and Economic Security Act, aka the CARES Act. It's basically a giant economic stimulus law designed to bolster business, hospitals, and individuals amid the pandemic, but it also relaxes certain healthcare regulations. Specifically, it amends certain regulations related to Part 2, including allowing certain redisclosures to covered entities, business associates, or other programs subject to HIPAA after obtaining the patient's prior written consent. So a patient no longer has to identify by name any individual or entity that they want to have the information attached to that consent. They just have to say, it's okay, basically go ahead and follow HIPAA rules on this. The CARES Act amends the statutory authority for disclosures with patient consent to provide, once that a patient gives prior written consent, the contents of a record can be used by anybody who HIPAA would normally cover. So it's no longer a requirement to identify by name the individual or entity who might receive information related to a record. The CARES Act also adds a new provision that prohibits discrimination against an individual because there are records that came to them that have to do with the individual's past substance use, current substance use, or treatment level. So basically, it works as a balance for the fact that these records might be more widely disseminated, and yet the fact that somebody has a substance use disorder or has been treated for it can't be used against them, specifically in healthcare, hiring, firing, terms of employment, housing, access to courts, access to social services benefits, or even being able to access services from organizations that receive federal funds. So the takeaways about the changes to 42 CFR Part 2, especially under the COVID-19 pandemic and the changes made there, here's what folks should know. 42 CFR Part 2 is contentious. It governs the way that addiction treatment records are stored and shared, and it's got stricter patient privacy and security data standards than HIPAA, which covers everything else. Some people love this and some hate it and think the parameters need to be more in line with HIPAA. Either way, Part 2 has been in a state of flux for years and has been temporarily overridden by the federal government to streamline patient care during the COVID-19 outbreak. It's a confusing time for these regulations. So when you get set up at your job, it's a good idea to keep an ear out for changes regarding 42 CFR Part 2 because it has implications for anyone who treats a client with a substance use disorder, past treatment, whether or not you're an addiction specialist. Got some resources here if you want to learn more. Thank you so much for your time.